questions I have is how long I can expect to be on HRT.
Well, every woman's a little bit different. So, depending on when you start, like if you start in the perimenopause years before your period has actually finished, I would say the average woman is on HRT like 5 to 10 years. But every woman is different. So, whenever you feel like you want to trial off HRT, you can certainly try to go off of it. And then we see, how your symptoms do and how you respond. If you're doing well and you don't have a big transition period and it's not really disruptive to your life, then you could stay off of it. But honestly, I'll tell you, for the OBGYNs of us that are going through this and are aging ourselves, we joke, but we say you're going to have to pry the HRT out of our cold, dead hands because you feel so good on it. And when you see all the health benefits and all the positive things it can do for your body, it really makes you wonder, like, why would you stop? This is kind of like, to me, I kind of look at it like a supplement to my life now, rather than a medication.
For
Um,
real.
yeah, because to me, taking my HRT is promoting wellness for me, and I'm a much better version of myself on HRT than off, and I think my family would tell you that too.
And that's the thing. That's what I've heard as well. When as long as the benefits outweigh the risks, why
Right.
not stay on it? But there is a point where once is it 5 years post menopause, they don't advise starting HRT at that point if you've not been on it before. Is that
Yeah,
right?
it depends on how old you are when you go through menopause, but yeah, the real hard stop is someone that's more than 10 years from menopause. Because at that point, when you reinitiate HRT after your body has gone through this like weaning out of the estrogen in your system, especially after age 60 in particular, if you start HRT after age 60, for those first 2 years that you're on it, you can have an increased risk of cardiovascular events and heart disease just
Interesting.
because you're introducing the medication, there's some inflammatory response in the body. And we know that after age 60, that risk is higher. That risk goes down over time. And also, everything's mitigated with your lifestyle, right? So, if you know that that's a case, but you still want to start, then you fight that by eating healthy, exercising, staying active,
All
doing
the
all
things
the things
that I do.
to protect your cardiovascular life.
Right,
Yes,
right. Yes,
exactly.
yes.